Hello everyone, this is Xueqin Huang from the first affiliated hospital of Shantou University Medical College. Today I will give you an introduction of asepsis. After this section, you will be able to describe what is infection and asepsis, identified medical and surgical asepsis, and explain the principles of surgical asepsis. Let's start with a question. Which of the following are microorganisms? Bacteria, virus, fungi, and parasites? Please figure out your answer. Yes, it should be all of them. Microorganisms exist everywhere. Water, soil, and also body surface, etc. However, most microorganisms are harmless. Some of them are even good for us. Infection only occurs when microorganisms invade the body tissue and grow there. What is infection? An infection is the growth of microorganisms in body tissues where they are not usually found. If the microorganism produces no clinical evidence of infection, it is called asymptomatic or subclinical infection. Some clinical infections could cause considerable damage. However, when a detectable alteration in normal tissue function occurs, then it is called a disease. The microorganisms that cause infection can originate from the patients themselves. We call it endogenous source. This might happen if a barrier between sterile and non-sterile tissues is broken, such as bowel perforation. We call microorganisms from environment like operating room and surgical instrument exogenous source. Patients with open wounds, indwelling devices, and compromised immune systems are especially at risk for exogenous infections. Transmission of microorganisms to patients may also occur through contact with inanimate objects. Cleaning, disinfecting, and sterilizing can break this link in the chain of infection. However, do you know the difference among them? Cleaning means removal of soil or organic materials. Objects are cleaned before disinfection and/or sterilization. Blood pressure cuffs and stethoscopes are disinfected in the hospital setting, which means eliminations of pathogens except spores. Sterilization is total elimination of all microorganisms, including spores. Instruments that are used for invasive procedures must be sterilized. Aseptic means getting rid of disease-causing microorganisms. It covers all those procedures designed to prevent contamination. What is aseptic technique? It means using practice and procedures to prevent contamination by pathogens. Aseptic technique is essential to decrease the possibility of transferring microorganisms from one place to another. It involves applying the strictest rules to minimize the risk of infection. Healthcare workers use aseptic technique in surgeon rooms, clinics, outpatient centers, and other healthcare settings. There are two basic types of asepsis. They are medical and surgical asepsis. In medical asepsis, we aim for reduction of organisms and prevention of spread. It is also referred to as clean technique. Surgical asepsis is more complex and it is used in high-risk areas such as operating theaters. It refers to those practices that keep an area or object free from all microorganisms and spores. This incorporates full sterile barrier precautions and should also be performed for procedures such as central venous catheter insertions. Common medical aseptic measures used for clean or dirty objects are hand washing, gloves, changing bed sheets daily, and cleaning floors and hospital furniture daily. Surgical asepsis refer to hand washing, the donning of surgical attire, that is caps, masks, and eyewear. The handling of sterile instruments and equipment, and establishing and maintaining sterile fields. Hand hygiene is considered one of the most effective infection prevention measures. There are 3 recommended levels of hand hygiene: social hand wash, antiseptic hand hygiene, and surgical hand hygiene. We have to ensure that the hand hygiene performed is suitable for the task. The efficacy of hand hygiene will depend on using an adequate volume of a suitable agent with good technique for the correct duration of time, and finally ensuring the hands are dry properly. For this table, we can see the different rationales, agents, duration, and indications. They are used in any situations involving blood or blood fluids except sweat, non-intact skin, and mucous membranes. Standard precautions include performing hand hygiene, using personal protective equipment such as gloves, masks, and eyewear whenever there is an expectation of possible exposure to infectious materials. Follow respiratory hygiene, cough etiquette in healthcare setting. We should ensure healthcare workers' safety, including proper handling of needles and other sharps. Follow safe injection practice. Clean and disinfect the environment appropriately. Everyone involved in an aseptic procedure is required to follow the principles that all objects used in sterile field must be sterile. Sterile objects must only be handled by sterile equipment or gloves and kept above waist level. Sterile fields must always be kept inside throughout the entire sterile procedure. When opening sterile supplies and adding items, take care to avoid contamination. Keep sterile surface dry and replace if wet or torn. If there is any doubt about the sterility of an object, it is regarded as non-sterile. Any puncture, moisture, or tear that passes through a sterile barrier must be considered contaminated. once the sterile field is set up. The border of 1 inch at the edge of the drape is considered non-sterile. Non-sterile items should not cross over the sterile field. For example, a patient not in a sterile gear should not reach over a sterile field. In summary, asepsis is a condition in which no disease-causing microorganisms and spores are present. As nurses, we should follow the standard precautions and principles of surgical asepsis in clinical practice to prevent hospital-acquired infection. That's all for this section. These are my references. Thank you. Next week, we will discuss the chain of infection and how to break it. See you next time. Bye.